Are you a mother, father, or you are involved in caring for children? If yes, then listen to Ask the Pediatricians every Thursday by 10 a.m. for insightful discussion on popular child health topics such as dangerous child health practices, immunization, infant feeding, developmental milestones, and so much more. You also get to ask questions on these topics and listen to answers to real-life child health issues by a pediatrician. Ask the Pediatricians Foundation is devoted to health education and information of parents and caregivers of children in the community to support you in raising healthy children. Don't miss Ask the Pediatricians with Dr. Gbemi because it's informative, educative, and interactive. Ask the Pediatricians Hour, the program for caring parents.
Hi everyone, and welcome to another episode of ATP Webinar, brought to you by Ask the Pediatricians Foundation. Ask the Pediatricians Foundation, we are committed to the health and welfare of our children globally, and especially in sub-Saharan Africa, where a lot of our children are still dying from preventable and treatable conditions. So we do that through our health education platform online, and we also do community medical outreaches. So our webinar is our teaching platform where we talk about very important topics that has to do with the health of our children every week. And I hope you've been learning. If you are joining us for the very first time, I want to thank you so much for joining us today. I am Gbemisola Boyede. I'm a pediatrician and I'm your host for today. And today we'll be talking about something very, very important. We've talked about it several times, but we'll not be tired of talking about it, as it is one of those conditions that we all need to know about, and not even only children, but also adults. On the 10th of February, usually the second Monday of February, has been designated International Epilepsy Day, and that was just a couple of days ago. And so we decided to revisit the topic of epilepsy. If you are just joining us, you are new to our platform, you may want to listen to our past broadcasts on epilepsy. It's available on our YouTube channel. It's available on our Ask Dr. Gbemi ATP podcast, or our Facebook page, or our Instagram live TV. So you can rewatch the past episodes where we've talked about epilepsy, where we've answered questions about epilepsy, where we've addressed myths and that has to do with epilepsy, because epilepsy is the most common condition that affects the brain, both for children and for adults. Unfortunately, it's also shrouded in a lot of myths and lots of misinformation, and it's one of the conditions that people tend to get scared about. And what we do on such a day, this week, where it is International Day of Epilepsy, is to kind of remind us what we need to know about epilepsy, and to help, most importantly, know that epilepsy is actually a condition that is treatable and that somebody can actually outgrow, or somebody can stop having epilepsy. So it's one of those conditions that we can actually manage and manage properly, and actually get our children free. But that is if people know and if people seek the right intervention. So that is why it's important for us to revisit the topic of epilepsy again. And so that's what I'll be talking about today, giving us an update on epilepsy. All right. But if you have any questions around epilepsy or any issue that has to do with the health of your children, remember you can always go to ATP Facebook group online, and you can post your questions there. Myself and my colleagues will be there to answer your questions. From Mondays to Saturdays, we are always there to answer any questions that you may have about the health of your children. and help you to know what to do or where to go depending on what the issue is. And you can watch all the past episodes of all our teachings on the same platform where you're watching right now, or on our YouTube channel, or on our Facebook page, or even our podcast channel. So I encourage you to watch out for all those previous topics that we've dealt with so far this year. So, but today we're just going to revisit again epilepsy. So, welcome to today's webinar. So, it's International Day for Epilepsy. Every second Monday of the month of February is designated a day for us to remember and to talk about epilepsy. So, what is epilepsy? Epilepsy, sometimes people tend to not like the word epilepsy, and people prefer word like seizure disorder. So it's still the same thing we're talking about. So whether you're calling it seizure disorder, epilepsy, but we tend to use the word epilepsy because it's the one that tends to most common, and that every kind of all encompassing for all the conditions that we're going to talk about. So I will stick with epilepsy. So epilepsy is a chronic, when we say something is chronic, it means something that is a condition that lasts for a long time, and it's a non-communicable. What that means is that it's not infectious, and that may sound like obvious to some people, but it is not. The number of times people are scared that somebody who is having a seizure, and if they bring out saliva from the mouth or the foam from the mouth, the number of times people are scared that if that foam or that saliva touches another child or touches them, that they are going to have epilepsy. It's amazing how people can believe that. So I just want to let you know, as part of the definition of epilepsy, that it is not communicable. It is a non-communicable condition. You don't get epilepsy by sitting with somebody who has epilepsy, or by living in the same house with them, or by sharing cup with them, or by eating from the same place, or by even using personal items. You're not going to get epilepsy. Neither are you going to get epilepsy if you touch somebody who is having a seizure, or somebody if their foam or whatever come out of their body during the process touches you. You're not going to get epilepsy. So epilepsy is not communicable. It's not like malaria. It is not like tuberculosis. It is not like HIV or all those kind of conditions. It is a non-communicable condition, but it is chronic. So somebody who has epilepsy tends to have seizures recurrently. So they may have it for many months or even years before they get better. We'll talk about that. So it's a condition that is chronic, non-communicable, and it has to do with the brain. Again, the number of times we have to address the fact that epilepsy is not a spiritual problem, it's not a witchcraft problem, it is not a curse or anything like that. It's actually a brain disease, if you like. So it's a condition that has to do with the brain, and it is important for us to get that. So people who have epilepsy have something going on in their brain, and it's a chronic condition, but it's not something that they can pass on to you. So just talking about definition of epilepsy alone, we can actually debunk some myths that people talk about epilepsy. So it's a chronic condition, it's not communicable, and it has to do with the brain. And how does it manifest? People with epilepsy have what we call recurrent seizures. So these are keywords. I deliberately taking my time going through the definition of epilepsy, because once we understand that definition, that introduction, almost all the things we'll talk about epilepsy will be straightforward. So epilepsy, if I already know, is chronic, it's not communicable, it's a disease of the brain, okay? And it is characterized by recurrence. So when we say something is recurrent, it doesn't happen once, it will happen more than once. So if somebody has a seizure once, they have not developed epilepsy yet. So, and of course, if they have a seizure without fever, and when we talk about seizures are what we call brief, sudden, involuntary episodes or movements. They can involve a part of the body or the entire body. And sometimes people are not aware, they are unconscious when it happens, and sometimes they may actually lose control of their bladder or the bowel during the process, so they may pee on themselves, or they may also pass to, or during that process. So those are seizures. So seizures are brief episodes that is involuntary, sometimes involve a part of the body or involve the entire part of the body. Most of us are familiar with a seizure that we call convulsion. That is when the children jerk their hands, their leg, or they go stretched out like that. But there are other forms of seizures that are not very as dramatic. So sometimes people may just kind of zoned out. They look at you as if they are not there, and then they come back to themselves. That we call absence seizure. Sometimes some people just, drop. Sometimes some children just, have what we look like an electric shock, what we call myoclonic jerk or seizure. So there are different kind of seizures, and some seizures actually manifest like behavior, where people begin to feel like as if they are tasting something, or they are smelling something, or they are, they behave in a funny way. So there are many different kind of seizures, but basically for all of them, something is going in the brain. The brain is one of the most important organ in our body. I'm not sure whether the brain or the heart is the most important to I guess people will say if your heart is not beating, you are dead. But if your brain is not working, then you may be alive, but you are actually also not able to do anything really. So that's why we talk about people being brain dead and all that. And then it's like there's nothing else after that. So the brain, most of everything we do is due to information released from our brain. Now, when people have seizures, there's an abnormal discharge in the brain. Okay, the brain communicates by sending messages or signals from one neuron. Those are the small uh, component that makes up our brain and our nervous system. So they communicate to each other and all that. So if I want to move my hand, my brain tells send a message to the muscle and in my hand to say, okay, flex or extend and all that. That is how our body works. So the brain is always sending messages based on what we want to do. Now, in people who are having seizures, there is a kind of abnormal message or a message that doesn't have a particular purpose, and it's just suddenly being discharged in the brain. So they start to check, not that they want to do anything, So that is what happens in epilepsy. So, and that will manifest as what we call recurrent seizure. Sometimes the abnormal discharge starts in one part of the brain, and then it will spread to the two sides of the brain, and that's why the seizure may involve the entire body. So if somebody is having seizure, which is abnormal discharge from the brain manifesting in some involuntary episodes, and they have it more than once, then and without fever, we say the person has epilepsy. So that is just that. So some people will have seizure once, and that is it. We don't say they have epilepsy, but once people start having two episodes and more, and it's happening again and again, we say they have epilepsy. And like I said, seizures is because of the excessive electrical discharge in part of the brain. Okay, and depending on the part of the brain affected, it can lead to different manifestation. The most common one is what we are all familiar with, which is a checking of the muscles. So sometimes the person become unconscious and all that. So like I said, one seizure alone does not mean the person has epilepsy. Up to that, people that will have one episode of seizure in their lifetime, and that will be all. So we call, that about 10% of people in the world we have a seizure once, they won't have a second one. And so those people, technically, we don't call them, we don't say they have epilepsy. But once you start having two or more seizures for no reason, so, or what we call unprovoked seizures, then we say you have epilepsy. So seizure that is unprovoked, so that is very important, because sometimes when children have high fever, then you can have seizures, okay? And sometimes some people, maybe there are some other things going wrong in the body system, electrolytes imbalance, and that they can also have a seizure. We don't tend to refer to those ones as epilepsy because we know what is causing it, or a trigger, or but when something that happened for no obvious reason, no provocation, then we'll call that epilepsy. And it's actually one of the oldest condition ever recognized in the entire world. I'm sure most of people read your Bible, Bible talk about people who have epilepsy, talking about that young man that the father brought to Jesus and was having a seizure. So epilepsy is something that is being recognized as far as back as 4000 BC, So it's a very common condition. It's a condition that has been known for a very, very long time, and is the most common brain condition. So it is something that we need to know. Unfortunately, despite the fact that this is one of the oldest condition in the world, that this is one of the conditions that most people know about, there's still a lot of fear, a lot of misunderstanding, a lot of discrimination, a lot of social stigma. It's like people don't want to share with somebody who have epilepsy, and because of that, people who have epilepsy sometimes are, discriminated against. They try to hide their condition away and all that, which should not be so. Which is why I really took my time to explain to us what epilepsy is. So you can see from the definition, it's something going on in the brain, abnormal discharge in the brain, causing some manifestation, and it's happening multiple times. It is not because of any case or any stigma or anything. I mean, any spell or whatever put on that person. It's not spiritual. It's not a spell. It's just a brain condition. Okay, and it is not communicable, so which is one of the reasons there's a lot of also stigma, because people are scared that they're going to catch it. You don't catch epilepsy. All right, so all this misunderstanding is one of the reasons we have a day like this, that we can talk about epilepsy, and the fact that epilepsy is treatable and it's actually curable. In other words, it's actually one of those conditions that we know we can actually treat, and we can put an end to it. And I have treated many patients, many children, because I'm a neurodevelopmental pediatrician, and I've treated many children with epilepsy who are now no longer having seizures, and they are seizure free, completely free from medication and all that. So it's something that is completely treatable. Now, how do you know when somebody has epilepsy? What are the signs? What are the symptoms? Of course, the obvious one is that people with epilepsy have seizures. They have seizures. But unfortunately, the seizure itself is not the only problem that people with epilepsy will have. Because during the time they were having the seizures, because they are not in control, most of the time they are not conscious, other things can happen. For example, somebody who is having epilepsy may just fall because they cannot control themselves. You will know later why that is important, because the most important thing we want to do for somebody who is having an epileptic seizure is to keep them safe. All right. So sometimes they may fall in the process, and that can lead to them actually sustaining severe injuries to the head or to the body part, and sometimes they can sustain like fractures and bruises just from the fall and all that. And of course, because they may, weigh on themselves, they may pull, during that process, because they are not in full control of all the systems at that time. When they finally wake up, it tends to be very dramatic, and they feel psychologically affected. So a lot of people with epilepsy tend to be depressed about it. They tend to be anxious because they don't know when it will happen, and it can happen in schools, it can happen at work, it can happen anywhere, and it can be quite embarrassing for people with epilepsy. Just to let you know that epilepsy is one condition that can affect both the children and the adults. So even today, condition, it's active pediatrician, but we are not just talking about children alone. We're talking about adults. It's one of the most common condition affecting both children and adults, and about 50 million people in the world, 50 million people in the world have epilepsy. So it is one of the most common conditions. We have about maybe 7 billion people, and 50 million out of those people, you can do the mathematics, have epilepsy. So it's a very, very common condition. It's also one of the most well-known condition. And unfortunately, majority of people who have epilepsy live in the low and middle income countries like Nigeria, Africa, Sub-Saharan Africa. And the good news with epilepsy is that we can treat epilepsy, and 70% of people who actually have epilepsy can be seizure free. In other words, if we treat people properly, 70% of those 50 million will no longer have seizures and they will be free. Unfortunately, because of ignorance of all these myths and beliefs, people who need treatment don't come for treatment, or they don't go to the right channel for treatment. So people are going to the herbalists, they're going to church, they're going to spiritual houses and all that for cure of epilepsy. Whereas all they need to do is to come to the doctors. We can give you drugs for your epilepsy and they can be free from seizures. So a lot of people don't come for the right treatment, especially in, again, Sub-Saharan Africa. One of the, I've told you the good things about epilepsy is that we can treat it, some people can get better, but one of the sad things about epilepsy is that people with epilepsy are at risk of what we call sudden deaths in epilepsy, SUDEP. People can just die for, we don't know, for no reason. There's a higher rate of premature deaths in people with epilepsy, and it's about 3 times higher than people who don't have epilepsy. And this is more common in those who have epilepsy that have not been diagnosed, that have not been treated. So they are higher risks of death. So if there's anything I want to take home from today's webinar, is that epilepsy is just a brain condition. It's not a spiritual problem. Epilepsy is treatable. Epilepsy can be cured in 70%, because we do have some very difficult to treat epilepsy. Sometimes we have to use multiple drugs. Sometimes we have to do operation for some people with epilepsy, but they are not the majority, they are the minority. Majority of our children with epilepsy, we treat them, even adult epilepsy, and that they're fine afterwards. So unfortunately, most people who have epilepsy, 80% of them live in low middle income countries. 75% of such people don't get the treatment because, either ignorance or poverty or stigma or misinformation and all that. Also the stigma and the discrimination. So all these things is one of the reasons we have a day like this to talk about epilepsy. So epilepsy is not just a seizure. The people can suffer some psychological effects. Sometimes if children have recurrent seizures, it can affect their academic performance, either because they're always missing school, or even if they don't miss school, the drugs and even the seizure itself can affect their learning ability. And like we said, people with epilepsy are at higher risk of death, especially if they are not being properly treated. So I've talked about how common epilepsy is. Now, most of you will be wondering, why do some people have epilepsy? What is the cause of the epilepsy? Unfortunately, most of the time we don't know the cause of epilepsy. We don't know. In fact, most of the time, 50% of the time, there's no cause, or there's no identifiable cause. There are a lot of researches going on, and we think some epilepsy are genetic, and that is why they run in families. And in those olden days, you see people thinking they'll marry into that particular family because somebody has epilepsy in that family, and they are worried about them, but then they now joining with a myth that maybe if you marry into that family, then you are also going to have epilepsy, which is not true. But they are kind of correct in the first part that the fact that epilepsy can be genetic and it can run in family. So this day, because we're doing more genetic testing, we're able to actually detect, whereas the genetic cause of some epilepsy that maybe 10-20 years ago we will say we don't know the cause of the epilepsy. But so that's number one. So majority of epilepsy could be genetic, though sometimes we're not able to prove it. But if it runs in family, if it follows certain pattern, then we think it could be genetic. So epilepsy can also be due to what we call structural abnormalities, like the brain itself during the formation was not properly formed for whatever reason, and because of that there are some those parts of the brain that are not properly formed. They are they have that tendency to give the abnormal electric discharges, and when they go give those abnormal electric discharges, the child can have seizures and the child can have epilepsy. The good news is that sometimes we can treat those one by surgery and removing if it's something we can remove, but that's just another reason for epilepsy. So we'll talk about the genetic cause, then we'll talk about the fact that the brain itself, if anything is not properly formed in the brain, it can lead to abnormal discharges and epilepsy. Sometimes when children are sick and they have infection in the brain, like meningitis, encephalitis, cerebral abscess, when that illness clear, it can, cause some damages to the brain, and that can also lead to a child developing epilepsy. And that's why people with meningitis, or other brain infections, they tend to have seizures, and some of them, after the initial infection has cleared, they keep on having the complication of epilepsy. So infection in the brain, even infection and infestation of the brain, like worms. This is one of the reasons we also deworm our children regularly, because worms can actually enter into the brain, form a cyst there, and that can actually lead to abnormal discharge, and that can actually cause epilepsy. It's rare, but it has happened. There are other causes, metabolic causes, and all that. But so most of the time, 50% of the time we still don't know the cause of epilepsy, but there are risk factors. So that's one of the reasons why we still talk about the need for us to take care of our children right from pregnancy, because if there's any injuries to the brain during pregnancy or delivery of the baby, that brain damage, or even from after the delivery of the baby postnatally, for example, jaundice, meningitis, they can cause damage to the brain. Once there's a damage in the brain, that brain is elepleptogenic. In other words, that brain can cause abnormal discharge at any time, and that individual with a brain that has some damage can have epilepsy. So babies that they don't cry at birth, babies who are born premature, and premature babies tend to bleed in their brain because their brain is so fragile. Even ordinary handling them, if you do it too much, they start bleeding their brain. Sometimes for no reason they bleed in their brain because the blood vessels in the brain are so fragile. And that will lead to brain damage, and that can lead to epilepsy in future. Or children who did not cry when they were born, birth asphyxia, that can also cause brain damage. The brain is one of the most sensitive organ in the body. It is so very sensitive. Like if it doesn't get what it needs within a few minutes, the brain starts to die. And once the part of the brain is damaged, that part of the brain is gone. That part of the brain cannot be recovered. The brain does not heal the part that is affected. The part that's not affected can take over the function, what we call plasticity, but the part that is damaged and gone forever. Okay, so those are the reason why we need to, when we talk about prevention of epilepsy, we have to come back to these causes. Of course, we can't do much about genetic causes, but things like anything that can cause brain damage, like sepsis, like prematurity, like jaundice, we can do something about those ones. Because when we prevent those ones, we'll prevent brain damage, and then we'll prevent epilepsy. in a way, okay? Head injury for the adults, and also for children, because some of us are so some of our mothers, apologies, but some of us are very careless with our babies. I've seen mothers giving their babies to their baby, allowing children, toddlers to carry newborn baby, and then they drop the baby. People do all these unsafe child practices, throwing the baby up in the air, all I don't know for what reason. And sometimes baby has fallen and they suffer head injury. When baby starts to walk, we just let them, sometimes leave them alone, and they fall a lot. Mothers put babies on the bed, no guards, no protection. Babies roll over from the bed, they fall. And mothers take it so flippantly, and the way they ask questions like, yeah, my baby rolled from the bed and fell, and what, and I'm like, do you know the lifelong implication of some of these things we take with so much um, levity, because each time that baby falls and they hit their head, they can suffer an head injury. An head injury can cause brain damage. Brain damage can lead to epilepsy. And not only epilepsy, that child can develop neurodisability. So we really need to make sure all these babies just falling anyhow, or we're just taking it so there's some big deal. It's a big deal, because head injury can cause brain damage, epilepsy, and disability. For adults, they can have stroke, and we'll talk about even tumor, cancer. Brain tumor can affect children, can affect adults, and sometimes it can. The first signs will manifest will be with epilepsy. I've had a child who came to me for epilepsy, and I was in a private setting then, and I just said, let me just do a proper workup. And I just had to do a brain scan as part of my workup for that child's epilepsy. And lo and behold, that child actually has a brain tumor. And the child was not even showing all the typical signs of brain tumor, was not vomiting, but just the seizure. And I just do the brain scan just as part of routine. I wasn't even thinking of a brain tumor in that child, but that child had brain tumor. And luckily, we were able to get the neurosurgeons, and they were able to operate the child, and the child was fine, and the child doesn't have any more seizures. So there are some causes of epilepsy like that we can pick and we can treat, and the child will do well. So basically, there are many causes of epilepsy, and sometimes we don't know. We don't know. That's the truth. We don't know. All right. So I've talked to you about what epilepsy is. I've talked to you about what are the signs of epilepsy, the seizures. So the seizure can be quite different. There are different types. Some the child is aware. Sometimes the child is not aware. It can also affect adults. And then we've talked about the causes of epilepsy. That 50% of the time we don't know. There are some conditions we just don't know. We don't know everything as doctors, but we know there are some that we know. So we know about genetic causes, we know about brain malformation, brain tumor, infection in the brain, head injury, anything that causes brain damage, basically. And the reason why I'm emphasizing those ones that we know is that while we cannot do anything about the ones we don't know, we can definitely do a lot about the ones that we know the cause. And if people ask all the time, how do I make sure my child doesn't have this? How do I make sure my child doesn't have epilepsy? It is by knowing the things you can prevent. And I've already alluded to them, but I'm going to come back to them. But before I go to the prevention of epilepsy, let's talk about the treatment. Again, I have good news for you. Epilepsy is treatable. Epilepsy is treatable. Epilepsy is curable. And that's a nice thing for us to say, because, as pediatricians, sometimes we don't have treatment and care for some conditions. We only manage them. So when I talk about, for example, autism, we don't have a cure. We don't have a specific treatment that will take away autism. But epilepsy is one condition that we can actually boost and beat our chest that we can deal with it. And really, I have many children that I have treated personally, and they have outgrown the epilepsy and they're doing well. So that's the good news about epilepsy. We can treat epilepsy. So please, if your child has epilepsy, don't be scared. Don't be worried. Don't be depressed. Just see your pediatrician, preferably a pediatric neurologist, and we can treat the child. We have so many drugs that we use to treat seizures. We call them anti-epileptic medications, AED. So we have anti-epileptic drugs and anti-epileptic medications that we can use to treat epilepsy. We have maybe over 20 of them, and we're developing new more. And so the most important thing is to make sure we get the right drug for the right child. And sometimes it's difficult to know, but I'll just give us some basic principles. There are some drugs now that we don't use in certain groups. For example, Epilim, sodium valproate, is a very common anti-epileptic drug, and it is a broad spectrum anti-epileptic drug, but we find out that it can cause fetal malformation in a mother, in adults, in a childbearing mother, who get pregnant and is on epilim. The children can have some complication, the baby in their womb. So we try now to avoid that in female children or female teenagers, people that we know are likely going to can get pregnant anytime, or if at all we're going to use it for them, because sometimes that's maybe the only one that works for them. We get them to sign that they are going to do contraceptives and they won't get pregnant while they're on that medication. But we have so many other ones. We have levetiracetam, Keppra, we have carbamazepine, Tegretol. I'm also using some common trade names that people are familiar with. So we have many drugs. So, and there are ways we know which one to use. So epilepsy can be what we call focal or partial, or it can be generalized. So there are drugs that work well for partial seizures or epilepsy, and there are drugs that work well for the generalized epilepsy. There are drugs that we use for things like absence seizures. There are drugs that we use for other form of seizures like infantile spasms, for example. We use steroids, ACTH, and the rest. So we have different drugs. The good news is that, but when we start your child on anti-epileptic medication, please, it is not a drug that we start and then you go home and then you don't come back again. I've seen a lot of parents ask me questions about epilepsy on our Facebook group, and they've given them medication. Maybe the child is doing well, no problem, and then the mother just said to stop the drug on their own. That's not how it's done. No, please, when we start your child on anti-epileptic medications, you need to come to us regularly. We need to monitor for the side effects. Sometimes we need to do blood tests. And the fact that we've started medication and the child does not have seizures again does not mean, okay, it is not like malaria drugs that you stop after 3 days, so 5 days. It's not antibiotic that you stop after 1 week. No. When we start your child on anti-epileptic medication, we usually give it for a long time. It's a chronic condition. It is a chronic condition, so the treatment is also a long-term treatment. Minimum, we are giving that drug for 2 years. Most of us pediatric neurologists, pediatricians, we will not treat a child with epilepsy less than 2 years, and it doesn't matter. I know it's very tiring and very difficult for parents knowing that my child appears to be well, the child is not having any seizures again, but I'm still giving the medication. Yes, you have to give the medication. So you have to give that medication for minimum of 2 years. So please don't collect prescription for 3 months and then run away. You have to come to us. You have to come. We have to see the child. Sometimes we need to adjust the medication as the child gets bigger. We are watching out for side effects. Those medications have very serious side effects. Sometimes we're checking the blood, we're checking for liver function, making sure that the drug is not affecting the child's liver or kidneys. We need to check all these things. So when we're putting your child on medication, the first thing I do with my patient before I put them on drugs is to have a long conversation. Sometimes 1 hour, we're just talking about drugs. We're talking about the side effects. We're talking about why the child is going to be on this drug. We're talking about how long the child is going to be on this drug. We're talking about the fact that when we start the drug, we start with a small dose and then we begin to increase it, because sometimes we start with one drug and we are lucky it works, the seizure stopped and the child is doing so well and we are happy. But sometimes we start with one drug, it appears nothing is happening. Please, that does not mean we don't know what we're doing. That does not mean doctors are fake, they don't know their work. No, that is how it works. We have to do what we call titration of the medication. We have to increase it gradually. So please don't run away. Come to the clinic. We will increase the medication dose, and sometimes we have to increase and increase until we get to the maximum dose. Our goal is to give your child just one medication, but sometimes we're giving one medication, we're increasing it, but the seizures seem not to be listening to us and it's not going away. Sometimes we have to give this second medication, or we change. We try as much as possible not to give your children too many drugs. We want to give the child just one drug that will do the work. Okay, so we give the medication that we think should work based on the EEG reports, based on everything we've gotten. And sometimes we are lucky it works, but sometimes we are not, and it doesn't seem to work. Unfortunately, there's no textbook that tells us which drug will work for which child. Unfortunately, there is none. So we have to sometimes try. So we try one. If it doesn't work, we try a second one. We may stop the first one and try a second one. And one thing with anti-epileptic medications that we don't just suddenly stop them. Even when they are not working and we have to gradually withdraw them. We gradually reduce the dose. And even when they are working and we have used them for 2 years, we've done our EEG, it's normal. We've done a brain scan, there's no brain abnormality. So we think we can take off the medication. We don't just suddenly stop anti-epileptic medication. This is one of the most common dangerous practice that parents do. So a lot of parents just tell me, oh, my child don't happen to again, I just stop the drugs. Please don't. You must never do that, because when you do that, the child is going to what we call a rebound in the epilepsy. So they start having more seizures. And the worst part of it is that we may never be able to go back again and get that child to baseline. We now go back on the drug the child was using before, it may not work again. And then we are back to ground zero. So please don't you ever, on your own as a parent or even as adults, stop a medication for epilepsy. You must never suddenly stop it. Another thing while I'm still on that is when children are sick and they are not eating, or they have to go for surgery, they have to go for operation. Mother will say, oh, my child is going for surgery, so I stop the drug. My child is having fever, it's not eating, so I don't want to give him. Please, no. You must always give anti-epileptic medication. Even if the child is having surgery and they told you that the child must not eat or drink water, the child must take the seizure drugs. They must take it. Because once you stop that medication, the body interprets it as you suddenly stop. And what happens is that the child will have rebound seizures. So epilepsy drugs must always be taken. The child is sick, the child must take it. The child is going for surgery, don't eat anything, the child must take it. The child is fasting, the child must take the medication. That is very important for us. You don't suddenly stop anti-epileptic medication. And that also applies to adults. I know I'm saying child a lot because I'm a pediatrician, but please, that information applies to adults as well. The child or the adults, the person must always take the medication. When we are ready to stop the medication, we gradually stop it. We will reduce it a little at a time. So let's say the child is on 200 milligrams twice a day. We must reduce it gradually. Another thing that reminds me also that anti-epileptic medication must be taken strictly according to the time. So if you say this drug is 12 hourly, in other words, you take it 8 a.m., it must be 8 p.m. There's nothing like I take it anytime I like in the morning, I take it anytime I like in the evening. No, we are very, very particular. So you have to take it when you're supposed to take it. So if you take it 8 o'clock in the morning for a 12-hourly drug, it has to be 8 p.m. So you have to work it into the routine. So maybe, and most of those medications you can take them without food. So the fact that, oh, child has not yet eaten doesn't matter. So some of the time for children who go to school, it's better they take it before they go to school. So because some schools don't like to give the children drugs. So maybe as they're brushing their teeth, they must take their medication. Or if they're having breakfast 7 a.m., they will take their medication at 7 a.m. Then you can give the night one at 7. We try as much as possible to give you a drug that you can take once a day or twice a day. Very rarely we get the one that you have to take 3 times a day. We try to avoid 3 times a day. We try to give you what we call the chrono medication, those ones that you just take once. I will at least try to make life easier for everybody, but sometimes we have no choice than to give you the one that you have to take twice a day. And for children that tend to have difficult to treat seizures, they may have to take multiple drugs and they have to take them in different time of the day and all that. But it's so important. I think the major issue with epilepsy is that people are always impatient. So that's why I told you that when I want to start my patient with epilepsy on treatment, I actually talk to them for over an hour, just talking. That is the treatment. Or parents understanding all this information. You can see how long it's taking me to deal with all of it alone, and I've not even talked about everything. And some children have their own allergies that we must not give. We have to factor all that in. And if the medication is not working, don't just stop it. You have to come back to your doctors. Okay, you must have a direct access to your doctors if your child is on anti-epileptic medication, so that we can always adjust it. And when we're ready to stop it, we sometimes stop it over like 6 months. We don't suddenly just stop the medication. We give it gradually and reduce it gradually until we stop it, and we monitor even after we stop it to make sure the child does not continue to have seizures. So if your child has epilepsy, you've been to the hospital, please don't quickly give up on us. Please be patient with us, because we sometimes have to do a lot of trial and error till we get what works perfectly for your child. That does not mean hospital is not working. That does not mean drugs are not working. That does not mean you should leave and run away, which is what most parents do. And unfortunately, that makes the seizures worse. And please don't go and fast those children and say you are doing fasting prayer. I believe in prayers. Pray, but you don't have to stop the child from taking medication or seeing the pediatrician. So we, the pediatrician, be doing our own part while you are also doing your own part by praying and let God do his own part. But please, all of us have to work together. We're on the same team. We all want the seizures to stop. So please, let's do the right thing. So apart from drugs, there are other treatments for epilepsy. Most of the time we don't tend to use they are not the number one. The number one is that use drugs, but sometimes for some difficult to treat epilepsy, which can happen in some cases, like I said, maybe up to 1% or 10% of seizures can be very, very difficult to treat. So for those ones, we use things like ketogenic diets. They have the way that we have special dietitian that will walk you or your child through that process. There's a lot of weighing, there are lots of other things, but basically ketogenic diet is a treatment. We also have surgery. We actually do epilepsy surgery. We also have vagus stimulation. So we have different other form of epilepsy. By the time your child needs those kind of epilepsy treatment, we're talking about a tertiary level treatment. Most pediatrician can treat epilepsy that are common, doesn't have much issues. If it's a little bit more complex, then it's a pediatric neurologist or neurodevelopmental pediatrician. But by the time you are needing multiple drugs, epilepsy surgery, then we are referring you to the epilepsy experts as a tertiary care center. So those are the ways we manage epilepsy. In the last few minutes I have, I'm going to talk about prevention of epilepsy. So I've told you epilepsy has to do with the brain. It is not spiritual. It is not demonic. It is not witchcraft. It is not any of those things. It is not what you hate or what you didn't hate during pregnancy. Those kind of beliefs that people have. And let's just take away the myths. It's just the same way you have issues with your eyes and you need glasses, the same way you have issues with your teeth, you go to the dentist. That is the same way issues can happen in the brain, and it can lead to epilepsy. Okay. And so in terms of prevention, 50% of the time we don't know the cause of the epilepsy, so we can prevent it. Epilepsy due to genetics, we can't do nothing about it. It's already part and parcel of that person's DNA. So there's not maybe when we get to gene therapy, but right now it is something we can still dream of, but we don't have any treatment for that, prevention for that. But the ones we can prevent are those epilepsy due to brain damage. And if we can do all we can do to prevent damage to the brain, especially the brain of the developing child, we will really reduce a lot of epilepsies. Okay, so we have different level of prevention. We have what we call primary prevention, which is when you don't want the disease to happen in the first place. Then we have secondary prevention, which is treating the disease, diagnosing and treating it early so it doesn't get complicated. And then we also have what we call tertiary prevention. I forgot to talk about status epilepticus, but it's a form of epilepsy that can go on and on for 30 minutes, and that can really associated with high rate of fatality. And but it's not something I'm going to focus on today. All right, but let's talk about primary prevention. Please avoid brain damage. Please, let's do antenatal care so we don't have preterm babies. Preterm babies' brain are so fragile. Even just to handle them, they can bleed in the brain. Even without touching them, they can bleed in the brain, which will cause brain damage. So we want to make sure all babies are born at 37 weeks as much as possible. We don't want them born preterm, because preterm, actually a very extreme preterm, less than 1 kilo, less than 28 weeks gestation, they are prone to brain bleeds and long-term complication of epilepsy. We want to prevent jaundice or manage jaundice properly. Once the child has jaundice, please, that's why I always scream, jaundice is an emergency, it's a brain emergency, because any jaundice that is too high, that is not properly treated, will cause damage to the brain, and then that can lead to epilepsy. We want to avoid brain head injury. All this one, our babies are falling, rolling from the bed. Mothers, please, you are taking it too easy with these things. We're talking about brain damage here. We're talking head injury. We're talking brain damage. We're talking epilepsy. We're talking disability. Please don't keep your baby on beds without guards or making sure there's no way the baby will roll off. Don't put your babies on the couch or the sofa and let them sleep there. Don't give your babies to children to carry. And it's a sister. Sister is 5 years old, carrying a 2-month-old baby. We're talking about head injury. We're talking epilepsy. These are things that we can do something about by making sure we don't allow it to happen in the first place. Let's make sure our children are immunized so that they have all the antibodies to fight infection in the brain, like meningitis. So we have the meningococcal vaccine, the HIV vaccine, the pneumococcal vaccine, even the measles vaccines. They prevent all these brain infection, meningitis, and encephalitis. So that will also protect our children from infection in the brain that can lead to epilepsy. If you suspect children have cancer of the brain tumors, we can get to a treatment on time, and those children will be treated. And most of the time when we treat them, once they have benign tumor, they are fine and the seizures stop, So those are the primary prevention of things we can do. Secondary prevention, if a child is already having seizures, they have epilepsy, please come to us. Like you had, 80% of 75% of seizures are treatable. We can treat them and they can be seizure free. So don't go looking for babalawo or deliverance or anything. No, come to the hospital. I'm not saying you should not pray, but please come to us and let the doctors do our own part of it. All right, because when we treat seizures, it's the child's life quality of life will improve, and the child will not be psychologically affected. All those other things that go with epilepsy, the child can enjoy their own life. They can cook in the kitchen, they can swim, they can do anything they want to do, so as long as somebody is there supervising. So we can treat epilepsy, and if we treat epilepsy 2 years, most of them are fine. Over 6 months, we stop the medication and they go on with their lives. So, and that will prevent things like sudden deaths associated with epilepsy. Will prevent things like status epilepticus, because those serious complications are usually due to undiagnosed and untreated seizures. And finally, of course, tertiary prevention. For those who have very serious epilepsies, we can refer them for additional advanced treatments. So thank you so much. It's the International Epilepsy Day. I am Gbemisola Boyede, and for the past almost 50 minutes, I've been talking about epilepsy in children, and I've talked about how to prevent epilepsy. 25% of epilepsy are preventable. And one final message is the fact that we should all do our best not to stigmatize those with epilepsy. We don't want people with epilepsy, they already have the epilepsy. We don't want it to reduce their access to education. We don't want to reduce their access to jobs. We don't want to reduce. So let's take off the stigma that are children with epilepsy. Let's do our best. If you know somebody with epilepsy, please tell them to come and see us. Tell them to see a pediatric neurologist. We are always there in the teaching hospitals and all those other places. At least any hospital with a pediatrician, just see them there and they'll be able to support your child. Thank you so much. And if you have any questions about epilepsy or anything you need to clarify about epilepsy, please reach out to us. Go to our Facebook group, askthepediatricians.com. And ask the pediatrician on Facebook group, and then you can post your questions there Monday to Saturday. You can also read on our website www.askthepediatricians.com, and then you can also email askthepediatricians@gmail.com or Dr. Gbemi at askthepediatricians.com, Dr. Gbemisola at askthepediatricians.com, and I will be able to address your questions. Or we can actually, if you have a lot of questions, I can do another episode where I just take all your questions and we answer them. So thank you so much for listening, and I hope you've learned a lot. If you're watching the recording, also feel free to go to our Facebook group to post any questions that you may have. It's International Day for Epilepsy. The message is epilepsy is treatable, epilepsy is curable. Let's not stigmatize those with epilepsy. Bring them to the pediatricians, pediatric neurologists, and we can do our best to treat them, and then they'll be able to live their normal life. Thank you so much for listening to me. Have a wonderful day. Until another time when we bring you another important topic on ATP Webinar. It is Dr. Gbemisola say, have a wonderful, wonderful rest of your week. Bye.
Are you a mother, father, or you are involved in caring for children? If yes, then listen to Ask the Pediatricians every Thursday by 10 a.m. for insightful discussion on popular child health topics such as dangerous child health practices, immunization, infant feeding, developmental milestones, and so much more. You also get to ask questions on these topics and listen to answers to real-life child health issues by a pediatrician. Ask the Pediatricians Foundation is devoted to health education and information of parents and caregivers of children in the community to support you in raising healthy children. Don't miss Ask the Pediatricians with Dr. Gbemi because it's informative, educative, and interactive. Ask the Pediatricians Hour, the program for caring parents.